This is Bert Koppel, the owner of Homestead Senior Care in Birmingham, Michigan, and you are watching the training Caring for Someone with Alzheimer's Disease as part of our online training program for caregivers. Please follow along, and also you can do your test while we are doing this review. Welcome everybody to today's session. Today we'll be talking about a subject that I'm very passionate about, and that is caring for someone with Alzheimer's. While Alzheimer's and other dementia is not a normal part of aging, we are seeing more and more seniors affected by this horrible disease. Along with a growing number of seniors with dementia, we are also seeing more families stepping in to provide care, and I've witnessed this firsthand. It is no easy task. We know family caregivers need our professional support when caring for someone with Alzheimer's or other dementia. I am so grateful to all of you for tuning in today. I know many of you are probably familiar with the disease, but I want to start out by reviewing the basics so we're all on the same page. Then we'll go into more detail about the symptoms and how to minimize symptoms, and what we can do to help make this difficult disease easier to cope with, and how we can help families determine causes and learn strategies. By understanding more about these symptoms, it will help you feel more comfortable talking to families, and by arming them with the information that they need to be confident. It's also important to help family caregivers realize the importance of taking care of themselves. I am sure we all have a few ideas on self-care, but today we will talk about the conversation that you might have with families to prepare them for this role. And we'll close with some additional resources for you to use in your positions. Dementia is a decline in mental ability severe enough to interfere with daily life. Dementia is a broader umbrella term for many forms of dementias, including vascular dementia, Lewy body, mixed dementias, Alzheimer's disease, and of course, frontal temporal. So there are many different versions or types of dementia. They may just have different names. Here's a question for you. In 2015, approximately how many caregivers provided care to someone with Alzheimer's disease? Any idea? Was it 750,000, 1 million, 9.5 million, or 15 million? Well, the truth is, Alzheimer's is the number one cause of dementia, and we know that a huge number of caregivers, there's approximately 18.1 billion hours of care provided by 15 million caregivers every single year. Let's put it into a little bit of context around this discussion, and I know you all have heard these numbers, but I still want to share them with you because you're involved with the day-to-day care in the lives of these caregivers. In the United States, the Alzheimer's Association reports that in 2015, an estimated more than 5 million Americans have a type of dementia. Every 66 seconds, someone develops Alzheimer's. It's the sixth leading cause of death in the United States, and we know that 1 in 3 seniors die with Alzheimer's or another dementia that can be skewed because people with Alzheimer's often pass from a complication caused by Alzheimer's, such as pneumonia, because they lost their ability to swallow and the food got into the lung causing pneumonia and then they passed. And plus, the unsung heroes here is that the family caregivers step in. Again, I said this earlier, but 18.1 billion hours of care, valued at more than $221 billion in care, are provided. This costs an estimated $10.4 billion per year to the United States, and worldwide we know that more than 46.8 million people are living with dementia. On the next slide, let's look at a few more stats. For example, since having dementia involves the loss of memory, cognition, judgment, and the ability to take care of oneself, caring for someone with Alzheimer's or another form of dementia can be more demanding and more stressful than caring for someone who is ill but not cognitively impaired. We know that 59% of family caregivers of people with Alzheimer's and other dementias rated the emotional stress of caregiving as high or very high. In addition, about 40% of family caregivers report symptoms of depression. That's compared to 5 to 17% of non-caregivers. Most of the care was being provided by family caregivers who are devoting a large number of hours to the task each week. In addition, many family caregivers are the sandwich generation. We find them caring for their parents and their children. The care that they provide actually affects family life and work life. So how many family caregivers had to go into late or leave earlier, take time off from work to care for their loved one with Alzheimer's or dementia? Can you take a guess at that? Is it 17%, 32%, 54%, 61%? The answer is 61%. Along with stress, there's a real problem with isolation. So let's take a look at this issue. According to a survey through Homestead, 74% of caregivers report that they have become isolated. The majority of those surveyed say it's difficult and can be overwhelming caring for a loved one. They leave the house less frequently with their loved one. They feel a reduced quality of life. They stay home because it's easier due to the unpredictability of symptoms. And hopefully after today, you can help these family caregivers overcome the fear and gain confidence. Also, you'll hear a few times the notion of an Alzheimer's friendly biz, uh, how we do our part in educating businesses on the disease so that they can be more friendly towards these types of situations, which can then give caregivers the confidence to go out. We'll talk about more on this later. So let's do a quick refresher on the symptoms of Alzheimer's disease on the next slide. According to the Alzheimer's Association, the most common symptoms of Alzheimer's disease include memory loss that disrupts daily life. You may notice more reminder notes, difficulty completing familiar tasks, trouble managing paying their bills or writing checks, challenges with planning and problem solving, often trouble following a familiar recipe, confusion with time and place. You may forget where they are and how they get there. Trouble understanding visual images and spatial relationships. There can be a hard time judging distance, for example, running into things, misplacing things and losing the ability to retrace steps. You can lose your keys, but you can't retrace the steps to find them. Decreased or poor judgment. You may give away large amounts of money to telemarketers. Withdrawal from work or social activities. They quit going to Bible study or bridge club so others won't notice the changes. The changes in mood or personality. May be more easily upset, depressed, or even anxious. And problems with speaking and writing. Stop in the middle of a conversation, or maybe they have trouble finding the right words. So helping families understand the types of symptoms will be important when providing care. First, notice I refer to these as symptoms. These are not behaviors. This term is used interchangeably in the industry, but I prefer to use the term symptoms because we are talking about a disease that has taken over the brain. When the term behavior is used, it may seem to convey that the person is acting out on purpose, when in fact, the person has no control over what the disease is doing to their brain. When I'm training caregivers on Alzheimer's care, I like to do a quick exercise with them, and you can do this at your computer right now. Go ahead and write down 3 things that are very important to you. It can be tangible or intangible, or think about them. I'll give you a few moments to do that. Now that you have written down 3 things that are very important to you, I want you to cross out the middle one. And now cross out the first one and circle the last one that you wrote down. Imagine that you have Alzheimer's and the memory of those first 2 things were taken away. Now you can only remember the last one. For some, it may be that they can remember friends' names and faces, but not family members. I can only imagine how hard that would be for my family to accept. This disease does not allow us to choose, and therefore it does not allow us to choose our cognitive and behavioral symptoms of the disease every minute of every day. Most of the time, the person is exhibiting the symptoms because they are trying to tell us something. And when you are all about talking to families, you can explain to them that we will talk more about that in a bit. When talking about symptoms, it can be helpful to think about them in 2 categories, memory and behavior symptoms. And you can see on the slide a few examples of each type. And these types of symptoms may include aggression, anxiety, agitation, and even mood changes. We have to start explaining these symptoms in a new way to ensure that we're focused on the person's needs, as well as we are confirming that a disease is present, causing the brain to fail. When we talk with families about these symptoms of Alzheimer's disease, we need to recognize that some behavioral symptoms may put the safety of the person or others at risk. While other symptoms can be frustrating and difficult for the family caregiver, it's important to convey to the families, because let's face it, when someone mentions the word Alzheimer's, they fear the uncertainty that the symptoms can bring. I use this chart on the next slide to give some perspective into the whole discussion. The following chart provides a general ranking of these symptoms in terms of frustration, difficulty, and anger. It gives perspective, because when a family member is diagnosed with the disease, most likely the family fears the symptoms and the fear of these symptoms and their loved one may exhibit. So if we can break it down by the severity, it can help families better cope and anticipate potential symptoms. Some symptoms can be frustrating to deal with, like repetition. When someone repeats the same question over and over again, it's not harming the person with Alzheimer's, but it may be driving the caregiver a little nuts. For example, I had a client who would always ask about the next meal. When is lunch? Over and over again. And the caregiver was very frustrated, and to cope with the frustration, we brainstormed several responses to the question. Sometimes the caregiver would point to the number 12 and explain that when the little hand got to 12, we would eat lunch. The next time the caregiver would say, it's not quite lunchtime, but how about a snack? Or she would say, I will make lunch soon, but first we have to get cleaned up before we eat and shower or insert another activity. Or speaking of lunch, what was your favorite meal that your mom made you as a kid? As professionals, we can help caregivers identify the severity of symptoms and how to cope. Other symptoms can be harmful, like wandering, which of course needs immediate action. So this chart is all about putting symptoms into perspective and determining what type of action will be required. I mentioned earlier that a lot of times these symptoms arise when the person with Alzheimer's has an unmet need and they are trying to tell us something. We need to help our family caregivers tune into those needs. So let's take a closer look at some quick checks that families can do. Again, these symptoms usually arise when a person has an unmet need. And because language is often affected by dementia, people with this disease may tell you about their needs or issues by showing you. By acting in a certain way, they may be trying to communicate what they want or need. If caregivers are able to tune into these 4 categories on the slide, the caregiver can better understand and manage that unmet need. It's helpful to group these needs according to these categories. There's physical needs, emotional needs, social needs, and environmental needs. I want to give you some examples. Pacing back and forth. They may be trying to find the restroom, but they're unable to express it. That would be a physical need. Or out in public, they won't get up out of a chair or they're getting agitated. It may be that there are too many people around, and that's an emotional need. So you can see that this chart can be important in understanding and recognizing unmet needs. When this is understood, it can lead to more confident care and good days. So once the caregiver knows why a symptom is occurring, then what? If the unmet need is cold, we get a sweater. But what if it's sad? What do you do? Or what if it's loud or crowded area? How do you redirect the person into a safer situation? Well, let's take a look at that. The answer is all in the approach, and that is relationship or person-centered care. Most of you are probably aware of a person-centered care, and hopefully you're using this concept in your settings. The idea behind person-centered care is personalizing the care to the individual. We need to encourage families to use the person's life story, their likes, their dislikes, their hobbies, and favorite pastimes to help minimize their symptoms and provide meaningful activities for their loved one. They can work this personalized care into their loved one's routines and better engage them in a meaningful way. Most of the time, these caregivers know their loved one better than anyone else, and therefore they will know the best way to personalize the care. And sometimes they just need some examples and encouragement. And we as professional caregivers can provide them with tools and encouragement. So back to the example of a person being sad. We know that this may be the unmet need. And if we don't redirect the sadness, the person may begin to cry, become physically distraught, and even become angry. So if the family caregiver knows that the person's favorite pet and offers them their favorite ice cream, we can redirect that sadness. Or if it's in a crowded area, then the family can sense anxiety. By knowing their life story, you can redirect them to the next activity. So next, I want you to give some real examples and start with a personal story that includes an example of a behavioral symptom. And we will understand the unmet need or needs and look for ways to help a family approach the care and then learn conversation starters and prevention tips. And we'll walk through a few of these. And we'll do this so you can see these stories, so you can really start to discuss how to make this happen. This family caregiver was seeing behavioral symptoms during personal care. The caregiver said, Dad really became aggressive when you pushed him to do something that he didn't want to do, mainly with personal hygiene things. That last year, it got to be more and more difficult to change his clothing or to shave or to bathe him. Let's look at some of the unmet needs of this person. First, why does this happen? Maybe it has something to do with privacy. It's also important to check for those unmet needs. And caregivers need to be vigilant to check for the following. What are the physical needs? Is he in pain? Is he tired? How about the emotional? Is there fear? Does he feel insecure or a lack of control? Social, accepting care from a daughter or a female caregiver or a male caregiver or whatever the case is. And how about the environmental? Is he cold? Is there a safety concern that we should be aware of? Lisa's family started to use bed baths and no-rinse bathing wipes and dry shampoo. They would also take him for walks, so he was a little tired, but they used walks as an incentive of something they would do after the personal care task was done. And this is my favorite technique. They would sing to him as a method to decrease his combativeness during personal hygiene care. Lisa would start a song and get him to make eye contact, and his participatory singing allowed him to focus on something he loved and could still perform at some level. Lisa knew her father's likes and dislikes, so she was able to understand his routines and understand his unmet needs and came up with solutions to minimize the anger. Because bathing in personal care is a situation where symptoms can prevent themselves, or can, I'm sorry, because bathing in personal care is a situation where symptoms can present themselves, there are a few other techniques that we have learned. Set a regular time for bathing. Routine is always the key. Try breaking the task into simple, manageable steps. Make sure to explain the task before beginning. For example, step into the shower now. Let's get your hair wet. Put some soap in your hand. Rub it in your hair. Reassure this person each time that they complete a step. And setting the mood in advance will make for a more pleasant experience for you and your family member. For example, try some soothing music. How about some conversation starters with the families? I share these with you too because I want you to see how when we encourage families to approach care from a perspective of meeting needs and realizing the disease is causing the symptoms, the conversation naturally becomes softer. So for example, I'm here for you, Dad. We will get through this together. The nice hot shower will be over before you know it. And I'm sorry that I upset you. But let's listen to some music and try to make it better and take a bath later on. Just talking through an issue with a family naturally can lead to what could have been done differently, and that is where these proactive actions come into play. So, for example, plan ahead and don't overschedule. Be sensitive to the person's most alert and most tired times of the day. Keep a journal with key information and look for ways to help maintain control of their lives. Let's look at one more story. So this caregiver again was seeing a behavioral symptom with her mom, and that was pacing around the house. My mom accuses house guests of stealing her purse. So let's take a look at the unmet needs. The emotional, is she afraid? Is she anxious? Is she feeling a loss of independence? Social, she doesn't know how to express her feelings. The environmental, something in the environment is causing the anxiety. Is it a person? Is it a place? Is it an object? And let's look at some of the care approaches that we could suggest to a family. First of all, let's consider some of these conversation starters. Don't argue. Acknowledge their feelings. Step into their reality. Tell them that they're safe. Do not take the accusation personally. Set out to find the item and then redirect to a favorite topic, task, or activity, and then apologize and take the blame. There's nothing wrong with apologizing. You know you didn't do it. You know you're not at fault, but sometimes an apology goes a long way. So the conversation starters may go like this. Mom, I understand you're frustrated you can't find your purse. It's upsetting when you think you've lost a treasured possession. Let's go look for them together. Or Mom, this must be difficult for you. We'll get through this together. Or I'm sorry, I must have misplaced your purse. Let me show you where I put it. So that's how you can have these conversations with your loved one. And anything we can do to prevent this in the future is important. So let's take a look at some of those things. Let's keep a journal of the times of the day or situations that cause paranoia, like the time of day, certain individuals, places in the house, the same item is stolen over and over again. You can determine a safe place to store valuables. This way, when they're looking for something, you can show them where it's at and you know that they're safe. You can look for ways to help a loved one maintain control of areas of their life, like giving them choices and ask them for help in doing things. And of course, you can consult a physician, sometimes due to depression. So let's look at a few support strategies. How can we help? Well, again, you are the cheerleaders. By this time, you will be dealing with lots of emotions, and you may be working with a family caregiver who wants to be a caregiver, but won't ask for help. Or maybe a caregiver who doesn't want this as a full-time role, or maybe a caregiver who wants to control it all, and we all know that doesn't work with Alzheimer's. So let's talk through a few ideas or points that you will need this time around as you counsel family caregivers with this role. With Alzheimer's disease affecting the core mental functions of a person, providing care will not always be easy. So one of the most crucial things we can help caregivers understand is that they will have to change to be successful in this role. For example, when a person with Alzheimer's disease is talking about her mother, who is deceased, the role of the caregiver is to validate her feelings rather than bringing her back to reality about her mom. So if she's talking about her mom, enjoy the conversation and engage. Don't keep telling the patient or the client that their mother is dead. By being in their moment, caregivers will have a better opportunity for successful caregiving. Use this example that I just mentioned to demonstrate the art of validation. Have them start to practice this, because that is what it takes. It takes practice. It's very hard not to correct someone when they say something is wrong. But by realizing it's the brain failing that is causing this and the person is still feeling something, this is what I mean by change. The other change is in how the person is reacting. The person with Alzheimer's disease can sense it. We also have to make sure that family caregivers understand that caring for someone with Alzheimer's disease is doable. It can be done, and it is done all over the world. The key is to find the support in others in the same boat as themselves, and remember that finding a support group, whether it's virtual or together in a real life support group, is a great example. Here are a couple tips for caregivers. Make sure you educate yourself on the disease. Make sure you have respite. The number one way that home instead senior care can help families with respite is to go into the home and give the primary family caregiver a break once, twice, 3 times a week, a chance to get out of the house, to go interact with people who don't have dementia, so you know that you still have your mind's wit about you and you're still able to go out and get your hair done and fellowship with other people or go to church. It's good to get counseling to help you with some of those unmet needs that you have. Joining a support group so you can hear the war stories of other people and get great tips and tricks of what they're doing to overcome Alzheimer's disease within their situation. It's important to manage emotions, and that can be done through physical activity, through yoga, through meditation, through a spiritual walk, whatever the case is. And also social networks. Sometimes being on Facebook can be a great thing to give you a chance to verbalize what you're going through and to be part of a community, even if you can't be with them. There's also a great book out there called Confidence to Care, and this is a book that was actually written by Home Instead Senior Care. It's a resource for family caregivers providing Alzheimer's disease or other dementias care at home, and it gives you the confidence to provide the care within the home for someone that has this disease. There's also a great app that's available. It's called the Alzheimer's and Other Dementias Daily Companion app. And this is an app that you can download on your smartphone, and you can actually ask questions and look for resources in real time while you're providing care. There's even a 24/7 care line where you can call in to get advice and information on how to deal with someone who has Alzheimer's or dementia. This is absolutely free, and you can access all these tips and resources on the go by downloading the app. Some of the benefits, again, are tips for dealing with Alzheimer's and other dementia, 24-hour caregiving assistance via the toll-free number, access to caregiver resources. There's caregivers sharing their own advice. It's basically a support group, a virtual support group for caregivers to share with each other. And finally, there are additional resources out there that you can look for. Don't forget our Facebook page, Alzheimer's, remember for alzheimersfamily.com or helpforalzheimersfamily.com. There's caregiverstress.com. Another tip to share with families is to look for businesses that are Alzheimer's friendly. As we discussed earlier, families are staying home because they're worried about the unpredictability of the disease. There's quite a movement out there to help local businesses understand the disease and know how to handle situations. So Home Instead has joined this movement as well and is providing training for these businesses. So encourage your local grocery store or pharmacies and restaurants to consider some training, because that is what families want. And one other additional resource to mention is early detection. I know this might be a hard topic to approach, but it's encouraging families to get screened for early detection is the key to planning and navigating this disease. The good news is that most seniors and baby boomers are on Medicare, or soon will be, and each year Medicare offers an annual wellness visit that includes a cognitive assessment. So start talking with families about talking to their doctor about the test-taking questions, knowing the signs, and being able to get that baseline test, which is really important. You can also call the Alzheimer's Association with their 24/7 helpline at 1-800-272-3900. And again, don't forget to access the resources that we provide you at the office. Another great resource that Home Instead in Birmingham provides is our activity center. We have an entire activity center in our training lab where caregivers can come in and find 5-minute activities they can do with their patients or clients that have Alzheimer's or dementia to keep them engaged, to give them a sense of purpose. And these activities can be done over and over again, and it's absolutely free. We encourage our caregivers to come in to access these resources and to use them in the homes of their clients to have a better experience. At this time, you've completed your training. We now want you to go ahead and do your Alzheimer's online quiz. The quiz itself has a total of 12 questions. Complete those 12 questions, sign it, date it, and get it submitted to the office by the end of the month for training credit and also for payment for completing the training. Thank you for joining us today. I'm Bert Koppel from Home Instead Senior Care in Birmingham, Michigan.